Thank you, Mr. President. I think those of you who heard the town hall, we are continuing to accelerate testing at a record rate. We now have 370,000 tests that have been done. The majority of those, over 220,000 in the last 8 days, which of those of you who have been tracking the South Korea numbers put us equivalent to what they did in 8 weeks that we did in 8 days. This was made possible because of the HHS team working together, bringing together the strength of the FDA with the CDC and under the leadership of Secretary Azar. We're very proud of those numbers, but we know that we have to do more, and we continue to accelerate in testing to ensure that those who need the test are tested first and have access. As we talked about yesterday, we're working on the ability for people to take their own sample. That does not mean home testing. That means taking your own sample in the front of your nose with available swabs into normal saline that can be transported to the laboratories. That will allow and free up all of the drive-thrus to be very sparing on PPE, because you'll be able to do that with gloves rather than the full PPE outfits. This will allow for more of that PPE to be dedicated to our hospitals. I think those of you who are tracking this epidemic closely, like I am, you will begin to see that there is encouraging results coming out of Italy. We are impressed by the decreases that are seen in mortality, the number of people succumbing to this illness, and the number of new cases. Our new cases will continue to surge because we're still working on our backlog, although we will be in touch with the laboratories after this press conference to really find out how many are still in backlog and how many were run in the last 24 hours. Until we can get into a 24-hour cycle, we're going to have disproportional number of new cases compared to the actual new cases, and we will let you know when we've reached that equilibrium. Finally, and I know Dr. Fauci will talk about this further, we remain deeply concerned about New York City and the New York metro area. About 56% of all the cases in the United States are coming out of that metro area, and 60% of all the new cases are coming out of the metro New York area, and 31% of the people succumbing to this disease. It means, because they still are at the 31% mortality compared to the other regions of the country, that we can have a huge impact if we unite together. This means, as in all places, they have to be following the presidential guidelines that were put out 8 or 9 days ago, and this will be critical. But to everyone who has left New York over the last few days, because of the rate of the number of cases, you may have been exposed before you left New York. And I think, like Governor DeSantis has put out today, everybody who was in New York should be self-quarantining for the next 14 days to ensure that the virus doesn't spread to others, no matter where they have gone, whether it's Florida, North Carolina, or out to far reaches of Long Island. We are starting to see new cases across Long Island that suggest people have left the city. So this will be very critical that those individuals do self-quarantine in their homes over these next 14 days to make sure they don't pass the virus to others based on the time that they left New York. So if they've already are 4 days out, then it's just 10 more days. So I thank you if you help get that message out to others. Dr. Fauci?
Thank you very much, Mr. President. Deb. I want to just talk very briefly about 2 or 3 things. First, the issue of testing and how that has really changed the complexion of the approach that we're going to be able to take. Testing was an issue. We had many questions of testing in this room for a number of times. Now that we literally have hundreds and hundreds of thousands of testing out there, there are a few things that we can do with that. One of the things is that when we make policy about what we're going to be doing with the rest of the country, particularly those areas that are not hot spots, we need to know what the penetrance of infection is there. So we need to put a light on those dark spots that we don't know. We have to act policy-wise on data, and we're going to be getting more data, a lot more data. The other thing is that the areas of the country that are not hot spots, that are not going through the terrible ordeal that New York and California and Washington State are going through, they still have a window of significant degree of being able to contain. In other words, when you test, you find somebody, you isolate them, you get them out of circulation, and you do the contact tracing. When you have a big outbreak, it's tough to do anything but mitigation. We have an opportunity now that we have the availability of testing to do that. So you're going to be hearing more about how we can inform where we're going, particularly because we have the ability to test. The second thing is I just want to reiterate what Dr. Birx said about New York. It's a very serious situation. They've suffered terribly through no fault of their own. But what we're seeing now is that understandably, people want to get out of New York. They're going to Florida. They're going to Long Island. They're going to different places. The idea, if you look at the statistics, it's disturbing. About 1 per 1,000 of these individuals are infected. That's about 8 to 10 times more than in other areas, which means when they go to another place, for their own safety, they've got to be careful, monitor themselves. If they get sick, bring it to the attention of a physician, get tested. Also, the idea about self-isolating for 2 weeks will be very important because we don't want that to be another seeding point to the rest of the country wherever they go. And then thirdly, just one comment about drugs and the testing of drugs. You know, you heard yesterday about drugs being out there that physicians on an off-label way can prescribe it to give people hope of something that hasn't been definitively proven to work, but that might have some hope. I don't want anybody to forget that simultaneously with our doing that, we're also doing randomized clinical trials on a number of candidates. You've heard about candidates, but there are others in the pipeline where we'll be able to design the study, and over a period of time, particularly since we have so many infections, we'll be able to determine definitively, are these safe and are they effective? We're talking about remdesivir, other drugs, immune sera, convalescent sera, monoclonal antibodies. All of these are in the pipeline now, queuing up to be able to go into clinical trial. So I'll stop there and talk.
Thank you, Tony. Good job. Larry, how about just a quick few minutes?
Will be guiding him in making the decision. Where are you now with this timeline of 19 days from now?
So, I mean, that's really very flexible. We just had a conversation with the president in the Oval Office talking about, you know, you can look at a date, but you got to be very flexible. And on a literally day-by-day and week-by-week basis, you need to evaluate the feasibility of what you're trying to do. And, John, you asked for, you know, what kind of metrics, what kind of data. When you look at the country, I mean, obviously, no one is going to want to tone down things when you see what's going on in a place like New York City. I mean, that's just, you know, good public health practice and common sense. But the country is a big country, and there are areas of the country, and I refer to this in my opening remarks, that we really need to know more about what the penetrance is there. So if we do the kind of testing what we're doing, and testing will always be associated by identification, isolation, and contact tracing. And you find, after a period of time, that there are areas that are very different from other areas of the country. You may not want to essentially treat it as just one force for the entire country, but look at flexibility in different areas. So I think people might get the misinterpretation. You're just going to lift everything up, and even somebody's going like that. I mean, that's not going to happen. It's going to be looking at the data. And what we don't have right now that we really do need is we need to know what's going on in those areas of the country where there isn't an obvious outbreak. Is there something underneath the surface that says, wait a minute, you better be careful and really clamp down? Or what looks there that you don't really have to be as harsh as you are in other areas. So it's looking at information that up to this point, John, we never had. So it's a flexible situation.